evening, everyone. Welcome. Before we start with our program, we're going to have a few words from our President and CEO, Mr. Lloyd Howard.
Thank you very much. It is wonderful to see such a great community turnout associated with an issue that is so emotional and so important to our community, and that is teenage suicide and children's suicide. I recently had the unfortunate opportunity to see two families that I was very close to impacted by suicide, and to see the devastating impact on that family and their associated family and their friends. And I just feel, as a healthcare provider, as an organization that really tries to be leading edge with behavioral health, we need to do all we can at Tanner Health System and Willowbrooke to help people be informed and give them the tools and reach out to these children and give them other options. And I certainly realize that I'm getting old, and realize that times have changed with social media and the things that they face. And even my own daughter has seen a show that glorifies suicide. And I think it's important that we're going to have to solve this at a community level. And so I think that's what Tanner wants to do. This is a real privilege, and I think that we're going to have to all work together. And I hope that you'll go recruit a few other folks and in your roles, whether it's as a parent or whether it's a counselor or a teacher or just somebody that cares about their community. We've got to work together and address this issue. And I think if there's ever been a community that can do it, it's this community in the West Georgia region, and Tanner's excited about trying to play a role in that. I want to now turn the program over to Wayne Sinfeld. Wayne is our Senior Vice President over Behavioral Health, and Wayne is really the architect of our behavioral health program. Many years ago, I remember talking to Wayne, not even when he wasn't at Tanner, about some of the things he faced as he really helped troubled youth and a number of things that he's done in his career, and realized that we need to do something proactive about behavioral health. Behavioral health impacts all of us. How many in the room knows somebody or has somehow been touched by behavioral health issues? And that's remarkable. And as a country, as a state, and as a community, my feelings are we must be proactive in helping those that have behavioral health issues or potentially have tendencies there. And that's something that we're very committed. And I'm very pleased to turn over the program to Wayne. And also, I hope you'll get to know some of the team members, because I've never seen a more passionate group of professionals than the folks at Willowbrooke and all our behavioral health programs that are truly, it's a calling to make a difference in behavioral health. So let me now turn the program over to Wayne Sinfeld.
Thank you, Lloyd. And thank all of you for being here. You know, when we started Willowbrooke and just really thinking about in Carroll County, what did we need? 19 years ago, we had a small voluntary inpatient unit that primarily saw geriatric patients. And Lloyd and the board here at the hospital were considering whether or not we needed to stay engaged in a behavioral health program. Most acute med-surg hospital systems have closed behavioral health. You look across the state. And they made a decision to stay with it. And I came to Tanner at that point, and we have created a community-based grassroots behavioral health program, and that's what differentiates us. And seeing you out here today makes me feel great, because it is a tough subject. It's a sensitive subject. But very rarely do you see a community that reaches out to the professionals and say, we need to hear more. We need more information. We need to be more aware of what's going on with our kids. And I can tell you, we're in 16 counties across Georgia, all the way up into Floyd, all the way over on the other side of Coweta, Troup County, and Columbus. And this is the one county that has reached out and said we need more. And we're going to take this message to these other counties, but I want to applaud you and our community and the board and Lloyd for his vision in keeping behavioral health alive, active, and allowing us to grow into the most robust continuum of care that exists in Georgia. What we have at Willowbrooke, what we have in our community at Tanner, is the most robust continuum of care for behavioral health that exists in the state of Georgia. And I could go on and on, but before we get to the program, I want to just a special shout out to Deb. Bryce, if you can stand up for a minute, Deb. Deb has been with us for 14 years in various management capacities, and Deb has engaged her staff into school systems and has taken that message to us, and which is the primary reason that we're here tonight. So I'm going to turn this back over. Again, I want to thank you guys for coming.
Good evening again, everyone. Welcome to tonight's Advancing Your Health Education series, recognizing the warning signs of adolescent suicide. Thank you, first of all, for taking the first step to becoming more aware of some of the issues teenagers and children are facing. And thank you for working with us as far as the seating. When we first decided to do this program, people started to register, and we wanted to make sure that everyone would be accommodated. So thank you for that. Tonight you will have the opportunity to learn about signs and symptoms, and the panel will also share some Georgia statistics and more with you. The subject matter experts here tonight are available for any questions that you may want to ask. And like I mentioned earlier, there are note cards in your bag to fill out, and if you would just raise your hand with your card, one of the staff members located in the audience will come and collect the card, and then we will also have an opportunity for you to use the microphone if you like. Remember, tonight is about awareness. Awareness is power. Awareness is health. So now I will briefly introduce the panelists. We have Amanda Avila. She's a licensed practical counselor and program manager. She has more than 10 years of experience working with schools to provide mental health support and services to adolescents and children. At Willowbrooke at Tanner, she has served as an assessment counselor and worked directly with ages 5 through 8 as primary therapist in the partial hospitalization program. She is also certified in youth mental health first aid. We also have Brian Gibson, licensed practical counselor, primary therapist 3. He has been a licensed practice counselor at Tanner for 16 years. He works as primary therapist at Willowbrooke Partial Hospitalization Program, dealing with teens who experience suicidal thoughts and accompanying issues in teens. He is involved in various education and outreach activities for underprivileged teens and children. He also manages Regain Recovery and Renewal Program at Willowbrooke Behavioral Health. Megan Thompson. She is also a licensed practical counselor and assistant director at Willowbrooke Behavioral Health. She oversees the clinical program at Willowbrooke's Inpatient Hospital. She directs services in Willowbrooke's Partial Hospitalization Program in Carrollton, Villa Rica, and as well as Cartersville. She co-chairs the Behavioral Health and Substance Abuse Committee as a part of Tanner's Get Healthy, Live Well program. She is also very active in the community, advocating and promoting awareness of mental health and substance abuse. She also chairs a local interagency planning team. Deb Price is also a licensed practical counselor. She's a certified professional counselor supervisor and the program manager of community services. She provides clinical supervision for Willowbrooke Behavioral Health. She assists in managing 2 federal grants that promote mental health awareness in our schools and the community at large. She also assists with overseeing Willowbrooke's internship program. Okay, so without further ado, we will go ahead and begin. We're going to begin tonight's presentation with a showing of the next Netflix trailer, 13 Reasons Why.
Hey. Hannah, I'm not going. Not now. you say this to me when I was alive? My husband and I, we never got a note.
Hey, it's Hanna. Hanna Panabaker. Settle in, because I'm about to tell you the story of my life. More specifically, why my life ended. And if you're listening to this tape, you're one of the reasons why.
Is Hanna telling the truth?
Don't believe everything you hear.
Whatever Hanna thought she saw, she lied about it on those tapes because she's a crazy drama queen who just killed herself for attention. Hanna has secrets, Mrs. Baker.
Hannah's secrets are what killed her.
Maybe I'll never know why you did what you did, but I can make you understand how it felt.
You don't know the whole story. What else do I need to know? You're just like the rest of them, but I'm not. Everyone is just so nice until they drive you to kill yourself. And sooner or later, the truth will come out.
This is a wild game of survival.
All right, so that film, I would imagine, is what brought a lot of us here tonight. And it's what really has sparked a lot of conversation in the community about mental health and about suicide prevention and about what that whole topic entails. We wanted to bring together tonight a group of people to talk about, with healthy language and with facts and with true knowledge about this topic. It's been said several times, but we are beyond thrilled that this room is as full as it is. It speaks a large message in terms of just the importance of it. And we want to just acknowledge that this is oftentimes a fragile topic, but it's also one that we need to talk about. It's one that we really need to engage and bring to the forefront. You guys were given a bag in your chair. And in your bag, if you received a green bracelet that looks like the one I'm wearing, will you please take it out of your bag and stand up? Not everybody will have one, but a lot of you will. So if you found a green bracelet, please just kind of hold it up for just a minute. Okay, the people standing up, what you represent is how common our community is when it comes to mental health need and support. We treat mental health like it is this taboo, rare, it's only reserved for certain types of people, the viewer. And so part of our sort of passion about this evening is these topic areas are not for the faint of heart. They are not for sort of the young viewer that maybe hasn't learned how to handle some of these skill sets or learned what some of these words even mean. And so we want to just say to you, tonight we get 1 hour. And that is not anywhere near the amount of time that we would love to just spend with you and talk about this topic. So we're going to cover a lot, and we're going to kind of skim over quite a bit. But as you are listening, you have your card to jot down questions or thoughts or comments. But we really want you to think about how this impacts you on a personal level and also with those in your close sort of proximity and sort of your close support system as well. Okay? All right, so we wanted to just kind of bring some knowledge and some awareness to mental health. And we've already just said that 1 in 4 will meet the need for intervention. So that means that there's not a bunch of crazy people walking around the community. It's people that need support or people that can't figure it out by themselves and might need to reach out. Has anybody ever talked to a loved one or to a family member about a concern that they had? Has anyone ever talked to a loved one? Okay, you've reached out for a mental health intervention. It might not have come from a professional source. It might not have come from an agency, or you didn't have a bill sent to your insurance company for it. But we all utilize support systems and people in our sphere to help with our mental health and just our balance. And so if we can continue to kind of talk about just the normalcy of it and the fact that every single one of us have at some point in time the need for help, it takes some of the stigma off of it, and it takes some of the just the perception that if I ask for help, that might reflect a weakness or some sort of dysfunction within me. Okay, another sort of stat or fact. We know that 43% of teens have experienced cyberbullying just this year. We have a lot of people in this room from the school system or who have a job or some sort of a career that interfaces with teens on a daily basis. That is significant when we talk about how almost half of teens in this community here in Carroll County experience some form of cyberbullying. And here's another kind of startling stat. We also are told by teens that 80% of them report that they have zero parental rules or oversight over their social media use. So we're talking to parents right now, and we're talking to adults in the audience. This is significant. This means that when the cyberbullying is happening and things are happening through the social media and through their phones and through that technological exchange, there's a lot of damage that can potentially occur. And so we really want to encourage you to be invested and really be a part of your child and your children's just use and just the oversight of just some of the things that they're a part of with their social media and things of that nature. Here's just some more information for you. We want you to know how common mental health is. We know that in the ages of 13 to 18, that anxiety is prevalent about a third of the time. That means that 1 in 3 teens are walking around with an elevated level of just nervousness and anxiety. We need to know that. It's not reserved for just the few that sit in the corner. It is a pervasive thing in our community. Behavior disorders, 20%, 1 in 5. We want you to have knowledge and not just kind of read People magazine and watch, NCIS and shows that teach us about mental health. We want you to have factual information that you can feel competent and really, knowledgeable about what is happening in your community. Mood disorders, that includes depression, bipolar, things like that. We know that 14% are impacted by that sort of family of diagnosis, and substance abuse. I don't know how many of you in here have been personally impacted by someone that you've loved or someone personally that maybe you've known that has struggles with substance use and addiction and things. Thankfully, on our panel tonight, we have all three of you guys are sort of experts in that field, and so we want you to ask questions tonight. We want this to be, yes, it's a large room, but we want this to be a dialogue because it's that critical that we continue to talk about it. Okay, so the big so what of this slide, we want you to know that about 1/5 of our community is walking around with a need. That doesn't mean that it's just reserved for the people sitting in the corner or the quiet or the ones that are overtly acting out. It's you and I. It's people like you and I who need someone to talk to and who need support. And if we can treat it as such, then those that really need it won't feel the pressure or the stigma to remain quiet. They'll feel comfortable to reach out and to ask for help because it's just like you and me. We all need support at some point in time. Okay? Here's some more. You guys, this was actually released quite recently, within the last 2 years, but what we know by county, and really what we did was we sort of selected the surrounding counties here in Carroll. These are just by number the amount of deaths by suicide in terms of just the area. You need to know this. And even just within the last 2 years, we know that there have been even more. And it continues to be an issue, which is, of course, why we're here tonight and why we continue to talk about it. But this is just knowledge and information for you to have to take with you. Most recently, literally just within the last week, the Georgia Bureau of Investigation released this information, and so we wanted to share it with you tonight. In terms of just by age range, 15 to 17-year-olds, there have been 21 suicides in the state of Georgia just this year, just in the last year, okay? It's happening. And so we've got to talk about it. We've got to address it, and we've got to attack it head on because it will continue to happen if we don't do something different. So we want to applaud you for being here tonight, but we also want to task you with taking the challenge and continuing to talk about it, continuing to help lead people that need support to the resources that are out there. Okay, so part of tonight, some of you guys are well versed and you might have heard some of this information multiple times, and some of you might be in here fresh. I've never heard any of this, and I just want to soak up as much as I can get. So regardless of where you are on that continuum tonight, we want to share with you some things that could be risk factors for someone who potentially might be suicidal or who might need mental health intervention, okay? So some of the things that we want you to kind of be aware of: is the adolescent or is the person involved in stressful situations and events or involved in traumatic situations on a continuous basis? Are they exposed to trauma? We all know families, we all know loved ones, we all know friends, people that are exposed to certain things in life. That's a key factor. Another thing is it learns. Unfortunately, what we know is that if you know someone close to you who's in your support system who takes their life by suicide, we now are 7 times more likely to do it ourselves. That is significant to understand. And so sometimes what we see is communities having sort of concentrated incidents of this because it increases our odds. That's why you have to stop it. We have to continue to keep talking about it so that it can have, just the impact that we need to make it. Is the young person using chemicals? Or are they chemically imbalanced, meaning just their organic brain chemistry and things like that? Have they gone medical to get medical attention to kind of see, are they getting the treatment that they need from a medical perspective? Thankfully, the Willowbrooke system is involved in a medical hospital system, so we get to integrate both of those beautifully, and we can really attack the patient from the point of view that they need. And are there significant seasonal changes? A lot of us, yes, this is talking about summer, winter, spring, fall, but there's also significant times in our year that sort of trigger emotions. Not everybody in this room loves Christmas, because Christmas might be associated with something significant or traumatic or, sort of not a positive memory. It might be the fall, it might be, certain holiday or certain things like that. If you're aware of those young people in your life, that they have some of those really key sort of changes in the seasons or key times in their year, that's important to know. If I know that Johnny really struggles in the months of October typically, I need to really kind of hug tight to Johnny during that time frame and really check in with him and really make sure that I offer support and offer help when I can. Okay? All right, some other key sort of risk factors that we want you guys to be aware of. Has the person had a history of mental health? Just because you've had it once doesn't mean you'll continue to struggle, but that is a significant key. So if they've been in treatment in the past, that's important to kind of just notice. Do they have ongoing stress? Do they have a medical condition? These are all just things that you want to kind of cue your antenna up to and just kind of pay attention to in terms of these added up in sort of clusters could potentially be areas of concern for that young person in your life. Okay? We're going to flip the coin, and now we want to talk about the good factors, the factors that sort of protect our teens and protect our young adults from, potentially having some of these suicidal symptoms. Do you notice just general healthy practice? Do you notice general healthy hygiene, healthy study, healthy relationships? If that's the case, that's a good sign that that young person is doing okay. Do they have high self-esteem? And you guys can kind of just read down the list. Do they connect in some form or fashion with some sort of spirituality? It's not always a protective factor, but most of the time it can be. And do they have the ability to avoid substances and alcohol and drugs and things of that nature? Okay? If you add all these factors up, these are good things to kind of continue to really just encourage the young people in your life and to praise them for the fact that they're able to do some of these things. Okay. Here's some other good things. As adults in young teens' lives, are we taking notice and holding accountable? Are we monitoring what they're doing? In 13 Reasons Why, it almost feels like there's no parents. There's just teenagers hanging out, going to school, going home, going out, doing things. And so, again, we've got to be careful. I mean, you guys, even shows on the Disney Channel, parents are almost absent, or they're portrayed as sort of, silly, ignorant, you don't know what you're talking about. And so we need to be real mindful about just our oversight of young activity. Do they attend school? Do they have social support? Do they take part in constructive recreation activities? The last bullet point I'm going to make a note of, and then we'll keep going. If a young person can note and sort of announce and really confidently say they have at least one adult in their life that they feel like they can go to, that is huge. And most of us would assume that that would be a parent, but it might not always be. And I'm going to totally pick on them for a second, but I have teens that live in my house. I have 2 teenagers, and as much as I want them to come to me and tell me everything and for me to be their confidant always, I know that that's not always going to be the case. But if I know that they have a teacher or a coach or someone else in their life that they can go to and share personal information to, I'm cool. I'm great with that because that means that they've got at least one person that they can go to and trust. Okay, so those are key things to look for in a young person's life with regards to just those protective factors to look for. Okay. One of the bullet points that we talked about in terms of maybe what drove some of you to come tonight is also, how do I assess for risk of self-harm? How do I assess in a young person's life? How do I know if they're at risk for hurting themselves or for potentially even taking their own life? And so these are some things that we just want to share with you. Is the young person impulsive, generally speaking? Do they kind of act without thinking about things? Do they sort of just off the cuff just make decisions without consequence of what it might lead to or the ramification of their decision? That could be key. Other things to look for, are they even aware of some of the risk-taking that they're doing? For some teens who are, staying out till 2, 3, meeting people that they've met on the internet, out in public, doing various things. Are they even aware of some of the risks that they're taking? Awareness of time. This is not, do they get that it's 2 in the afternoon? This is right now, does it feel like forever? Does the teen make statements like, this will never get better. Life will always be this horrible. This is always. Those types of always and never types of statements are key to pay attention to because it means that there's no thought past next week or next month or the potential of the future, okay? Are they engaging in alcohol and drug use? And do they have the influence of others around them that may or may not be in a positive light, okay? Not one of these by themselves equal, oh my goodness, leave them in their bedroom and lock the door. But when you couple a lot of these together and really cluster some of these, that's when it's time to start asking questions and potentially taking that young person to a professional who can really assess and kind of figure out if they need more help. Okay? Here's some more signs and symptoms. Some are very overt. Some adolescents and teens will just flat out say it. They will admit that they're thinking about taking their life. Others will not. Are they doing notes? Are they writing about it? Are they expressing helplessness and hopelessness? Listen to their conversation. And if there is no conversation, ask. What we know is that young adults are waiting for someone to just ask. Many are flippantly walking past. How many of us go by someone on a daily basis and say, hey, how are you doing? But then we keep on walking. We don't ever stop to actually listen to how are you doing. And so if we don't want to know the answer, then just say hi. Don't ask how are you. Just keep going because the idea is that these young people oftentimes don't have anybody to really share and express to. We could potentially be that for them, okay? And you guys can kind of read down the list of some other things. All right. Here's some more. Has the young person started withdrawing from their social friends or from family? It's one thing to want to kind of hang out in your room at night or to hang out and sort of be away from others, but if it's unrelenting all the time, there's never any let up, that could potentially be a concern or a warning sign. Changes in mood, sleeping all the time or sleeping none at all. And that's hard to sometimes decipher between, is that a concern or is that just a teenager being a teenager? So you guys, at the onset of this tonight, we said we're going to skim the surface and we're going to share as much as we can in the time that we have with you. But by no means do we want you to walk out feeling like you have it all and that there's not still a ton to review and a ton to learn. And we're going to touch upon that in just a minute. But at this point, I'm going to hand off to Miss Amanda Avella, and she'll take us to the next section.
Okay, I just want to check in with everybody and see, first of all, does anybody have a question or a comment that they've written on a card? Would you hold it up if you have a question or a comment that you want to address with the panel? I've got I got one over there on the aisle, a couple towards the back. If somebody would grab those. Thank you. And if you haven't written it down yet, that's okay. We still have some time. Just take some time to jot it down really quickly. We'll ask again. But we just want to make sure that as they're sort of coming up, that we get those from you so that we can make sure that we address them. Okay, so what can you do? How do you talk to someone that you think may be having some suicidal thoughts or some feelings? Because it can be really scary. It can be a very intimidating place that you find yourself in, especially if you're not sure what to say, how to bring it up, how to ask, like Deb said. So the first thing that you can do is just kind of discuss your observations with your young person and say, I noticed that you've been staying in your room all night. I noticed that you're not hanging out with John, Bob, Sue, whoever that you used to hang out with. Can we talk? What's going on? Instead of using accusatory language or saying, you never want to talk to me anymore. I don't know what's going on with you. Even your tone can be really important in how you address it with your young person. Making sure that you appear confident. They're probably nervous too. You might be nervous to ask your young person what's happening, what's going on with them, but they need you in that moment to sort of be confident, and they need you to ask them whether you feel like you have all of the tools that maybe you need. You know how to ask, and you know how to get them to the help that they need. Tell them that suicidal thoughts don't have to be acted on. Just because someone has had a thought of suicide doesn't mean that that's the only choice. It doesn't mean that they have to go forward with it. There are other options. Realize that if you're not that parent, or even if you are and the young person confides in you, they may still be reluctant to tell a parent. They may still be reluctant to go and see a counselor, offering sometimes to go with them, telling them what might happen, walking them through the steps, and offering them the power to make some decisions about their own mental health treatment can help sometimes. Definitely making sure that they get the help that they need. Definitely making sure that they connect with the resources they need, that you're not taking those thoughts of suicide onto yourself and kind of trying to triage them by yourself is really important. And if the person is sort of acting aggressively, if they have a weapon, if they are threatening to commit suicide right at that moment, seeking help immediately and calling 911, knowing that that is something that you can do right there in that moment, that you may not be able to have the full conversation that you would want to have, making sure that you take in account their safety and yours as well. We're going to talk to you in just a few minutes about something called Youth Mental Health First Aid. This is where a lot of our information has come from tonight, and a lot of these slides have come from. We offer free courses in Youth Mental Health First Aid, and as Deb was saying, it is a much longer course that sort of teaches about what do you do, how do you recognize the signs and symptoms, and goes a little further in depth to kind of help you be that first triage, first responder. It's sort of a CPR, but for the mental health world. So we're going to talk to you about that in a second, but this comes from them, and you see that green block there, and that's really where we want to start intervening. It's where our young people are well, and we want to start working on some prevention, and we want to start working on some awareness and education, but we also want to sort of even get into when they start to become unwell, and how are we going to connect them to the resources that they need. So some talking points, and these are some suggestions for things that you might bring up with your young person, your teenager, an adolescent in your life. Suicide is not a common response, even though we've heard about how prevalent mental health is, and we know that suicide is definitely an issue. It's an epidemic in our country. There are other choices and there are other options. It's not romantic or valiant. It's not the way that you get revenge on somebody. It's not the way that you prove a point. There are other options. Sometimes it is a horrible, tragic decision that a person makes when they feel like they don't have any other options or they don't have any other choices. And we want to make sure that they know there's always another choice. 13 Reasons Why, I think sometimes have the tendency to sort of blame others for the decision that the young person took. And I know that there are probably some survivors of suicide. That's what SOS in Deb's earlier slide stood for. Survivors of suicide, you guys, I want to talk to you for a second. It is not your fault. It is not ever your fault. If you are impacted, if you have lost someone to suicide, even if you look back now and you say, I see all of these warning signs that everybody at Willowbrooke told me about, it's not your fault. You didn't make the decision. You didn't make the choice. Depression is a horrible thing. And sometimes someone is so lost in that depression and in that darkness that they forget that there are other options and they forget about the light. And that's what we want to offer you guys today. We want to offer to you the reminder that you can be the light for someone and you can help remind them that there is another way and there is something else outside of that depression. Thoughts of hopelessness and helplessness, again, they're common. People deal with this all of the time. We see it at Willowbrooke all the time as therapists, but it might be the first time your young person has ever felt this and they feel very alone. It's a very alone, lonely place to be in when they're in that depression. And so we just want to remind them that there are other people that have experienced this and that have gotten better, that recovery is an option. Support can come in a lot of forms. So if you or someone that you know expresses that they have had thoughts of suicide and don't feel like they've been heard, tell someone else, talk to someone else, connect that person with someone else. If you've even reached out maybe to a counselor or a therapist and you don't feel like you're being heard, it doesn't necessarily mean that therapy won't work for you or therapy can't work for you. It might just mean that you need to talk to a different therapist or you need to find the right one for you. Talking about suicidal does not make someone suicidal. So I want to kind of dispel that rumor and dispel that fear. I know that sometimes as adults we feel like, am I kind of planting the seed or am I kind of planting this idea? But you're not planting the idea. It's okay to ask. It's the silence that can be damaging. It's the silence that can lead to someone feeling alone. Sitting down and asking someone is okay. Use your resources. The reason that we're here tonight is we want to tell you all what your resources are. We don't know if you know all of the resources that you have in your community. Obviously, you know that Tanner's here. You know that Willowbrooke's here. You came tonight to kind of find out what can you do. We have lots of resources at the tables in the back before you leave tonight. I hope you guys will pick up some information to take with you. But just know what your resources are. Remember what Deb said, the clusters of symptoms can be a concern. It doesn't necessarily mean that someone is suicidal, or it doesn't necessarily mean that they have depression or bipolar or anything like that. We're not asking you guys to diagnose. We're just asking you guys to know when to help them reach out for help. I'm not a cardiologist, so I hope that if anyone in here had a heart issue or a concern, you wouldn't come to me and ask me questions about cardiology. I'm not the best one to ask, but I know that there is a hospital full, probably right downstairs. I could go and find someone and I could connect you with the right person to ask, who's going to know the answers to your question, who's going to be a phenomenal specialist and is going to help you with your recovery. And so we don't want you all to feel like you have to be master counselors. You don't have to be a master counselor. You just have to express love and concern and reach out to those young people in your life, asking a question. When the words don't necessarily match their face, they say they're okay, but they don't look okay. Asking another question is okay. And then if you say, you know what, I think we need to talk to somebody. I think you might need to see someone, knowing how to connect them with that someone. What resources are out there? So everybody has a different comfort level with their parent, with their teacher, their counselor, their peers. So they may have reached out to someone else, but we want you to know who you can reach out to as that person that your young person has contacted and said, I'm struggling with this, I need some help. You can call Willowbrooke at Tanner. That top number is a 24-hour helpline. There are counselors at that number all the time. So if it's 2 o'clock in the morning and your young person is having some suicidal thoughts, or they're finally ready to talk to someone, they can call that number. You can come in for a free assessment, It doesn't matter insurance, it doesn't matter age, it doesn't matter if they've ever been in mental health treatment before, it doesn't matter. A lot of times, as I said, your young person, this is their first experience with mental health. They don't know what to do. They don't know where to go. They don't know how to start. Parents might not know where to start, might not know what to do or where to go. We would love to help you figure out where you need to go. We would love to help you figure out which one of our programs can help your young person. We have everything at Willowbrooke, from inpatient to partial hospitalization, in-home services, school-based services, outpatient therapy. We have it all. And if we're not the ones, if our therapist is not the one to connect to your young person, that's okay, because we know some more and we can give you some more resources and some more options. These assessments are confidential. We protect it just like we do any other health information. We are protected under HIPAA, just like your regular medical doctor when you go into your doctor's offices and they give you your privacy rights and practices. We have the same rights and practices at Willowbrooke. If someone calls and asks me if you came in, I'm not even going to confirm or deny if you came in for an assessment unless you give me permission to. So you can ensure and you can assure your young person that no one's going to know. It's not going to go to their school. It's not going to be on their permanent record. All of our young people sometimes are concerned about their permanent records at school. It's not going to be on their permanent record. This is just an assessment to talk to someone to see what kind of help you might need. We do accept most insurances at Willowbrooke. Again, if that's an issue, we can help you with that and we can help you through it, but that assessment is free. So it doesn't cost anything to come in. Even if you choose not to come, you make an appointment, you choose not to come, that's okay. Call back. Get them to call back and make another appointment and they can come in. And we do also offer some assistance and financial aid at Willowbrooke. Again, we have the Youth Mental Health First Aid courses. That is a special grant through Willowbrooke. Miss Kelly Roberts is the coordinator of that program, and she is in the back at a table. If you're interested in learning more, if you're interested in how do I become that first responder, how do I provide that CPR for mental health, she would love to help you enroll in one of those courses. You can come out. It's an 8-hour training. Deb and I are both certified instructors in that as well, so you may see our faces again, and we would love to talk to you about it even more. We'd love to give you the opportunity to role play and practice the words that you say to someone. So if you guys are interested, please know that Kelly has some courses that you can sign up for here locally. And we have some additional resources for you here. I'm going to leave these up for just a few minutes as I talk about them. If anyone's interested, please feel free to take a picture. Please feel free to jot them down. That first resource up there is the Mental Health First Aid website. And so that's where you can go on and register for one of those courses. If you're not from this area, if maybe you came in from out of town, that will give you some courses across the nation that you can sign up for. And then the second two are both specific to the 13 Reasons Why. It just offers some more support. It offers more information. They're not necessarily counseling websites, but they're just more information for you to be able to talk to your young people and just to kind of gain some understanding about this topic. Then you'll notice the anti-bullying. That's a great one, especially for your young person to go on. There are places that they can click if they're a student, and there are even little different interactive tools that they can read about different children and they can read about their experiences. If they've been having a similar experience, maybe they've experienced some bullying in the same way of the different scenarios being offered, then it offers them additional resources. And then we also have the crisis text line. And that is a line, it's a number that you can text. So many of our young people are using their electronic devices these days, and that's the way they communicate. They can text, and there is a person that responds. So if they're having a crisis, and that doesn't necessarily have to be suicide, that could be, oh my gosh, I'm so stressed out, I don't know what I'm going to do, I'm so stressed about this test that I'm going to have to take, I just need someone to talk to. Then they can access some help and some support in that way, okay? And all of these resources we have personally checked out and made sure that they were okay for you to give to your children. They're also endorsed by the Department of Behavioral Health and Developmental Disabilities. So that can put your mind at ease that we are making sure that we give your children some good resources. Okay, so now we're going to move into our question and answer portion with our panel. So has anyone jotted down any other questions? Wonderful, thank you. You guys will just hold those up and we will grab those from you. Thank you.
All right, so let's make this very informal as best you can with 150 people in the room. But we really want you to feel comfortable to ask questions and just even, third person, hey, I know someone and I was just curious. But really ask those questions that you came here wanting to get answered tonight, okay? And we are actually going to start with one of the questions that some of you guys wrote, just to kind of get the conversation and the dialogue going. Okay, so you just want to pick that up? Sure.
So one of the questions that we're finding coming up a lot here is, how do I start talking about this with someone? When Deb and Amanda were talking up here, they brought up the idea that bringing up the conversation doesn't trigger someone to feel more suicidal. If they're feeling that way or if they're close to that, that's already there. So one of the big things is, how do we talk about it? The Jed Foundation had on that resource page that we had for you guys, talking points about just this film in general. A lot of people wanted to know, how do I talk about the film with my child, or the series rather, and how do I talk about suicide there? They bring up a lot of really good points that are easy to start up, but the first question that you can bring up is, how are you doing? I feel like things aren't going well, or I feel like you're not doing okay. And like Amanda said, sometimes those teens get up with us and they'll say, I'm doing fine. But there's always that hope that they want you to dig deeper. They want you to find out. If they're sitting there with you and having a conversation, there's usually a reason they're doing that.
And sometimes even asking, how are you feeling? Because fine's not really a feeling, right? So just dig a little deeper. How are you feeling? And again, mentioning those, I've noticed that lately you've been closing yourself off a little bit. Lately you haven't been doing as well in school. I'm getting some calls from teachers. I just want to talk to you about it.
Maybe they're even experiencing some of the clusters that you guys learned about earlier, or maybe they're making statements such as, I just don't want to live. So they're not saying they're suicidal or that they actually want to harm themselves, but they're making what we refer to as passive suicidal statements. Those count. That absolutely counts. You can feel it in your gut, use your judgment, use the education that you just received. That is huge. That is, I believe, in your continuum, it's being unwell, starting to be unwell. They haven't, maybe they don't have a plan yet. Maybe they don't have the means to carry it out yet, but they're obviously considering not being here with us, and that is when to act. Whether that be encouraging them to get a counselor if they are making statements, like I said, they've said in the moment, I just don't want to live, that's an emergency to us. You can call 911, you can take them to the emergency room. That is absolutely, if our assessment team was doing an assessment, that would be inpatient criteria. They're in a dangerous spot. So to be concerned that they will push you away or no longer want to have anything to do with you, that's not really the forefront at the moment. They are in crisis if they no longer want to be with us, and they're saying they no longer want to live. And in that moment is when you act.
Some of those other passive suicidal statements that we talk about would be things like, I just want to go to sleep and never wake up again. It could be things like, I want to disappear, I don't want to be around. Nobody will notice. I feel like all I am is a problem, and I don't want to be a problem for people anymore. Anything that relates to this idea of finality or forever, that's something to be aware of. And again, to dig deeper in, what do you mean when you say this? What does this word mean to you? What is, when you want to go to sleep and never wake up again, what does that mean to you? If you need help with those answers, you've got the crisis hotline that we put out. We've got plenty of crisis counselors that are out there. You've got 1-800-273-TALK is the suicide hotline. Anybody out there can call that. They can actually send someone to your home. The suicide text line, they can also send people out to your home. If you say, I feel like we're in danger right now, and I don't know what to do, they can give you some ideas, and they may just say, look, we need to call 911 for you. So there are always options and always places for you to reach out for help if you're not sure.
The text line is huge. We all know that our youth prefer to text or to communicate with one another, not sitting face to face and actually talking. It makes it easy to reach out. And y'all, that's even for adults as well. We talk all the time. It's really easy to say things to people via text or to post a message on Facebook because you're not face to face. It's the same with reaching out for help. It's a big deal to say, I need help. That's the first step. So to be able to do that via text with the program that we even tested out. When Amanda said, these resources are real, we tested them out. What happens when you text? Do they respond immediately? Absolutely they did. We were very impressed. Make your teens or your young people, your family aware of this texting option. It makes it really easy and comfortable and safe for them to reach out and say, hey, I need some help.
That number, by the way, is 741-741. And it's really easy to remember, and all you do is text something to that. We even asked them, what if we have a teen that is just feeling sad? They're not suicidal, and they just need somebody to talk to. And they said, absolutely. Give us a call or drop us a text, and we'll absolutely talk with them. They said on average, they send back and forth 40 texts per conversation. So it's not a quick thing where they're going to just drop it. And they've got a lot of training behind it too.
This can also be crisis of any kind. Oftentimes we have seen that with teens especially, they're very impulsive. So something happens. They got in trouble at school. Well, they were already grounded. They've been grounded for a month. You took their phone away a long time ago. Their grades are horrible. Now they've done one more thing. And they don't want to come home and tell you again that they've done one more thing. And so in the heat of the moment, the impulse takes over, and they do something ultimately that causes grave danger. It's a crisis line, so that it doesn't necessarily have to mean in that moment that they're thinking of harming themselves, but I'm so angry I feel like I'm going to bust the window out. Well, obviously that's not a good decision. They can text and even say that. It's an immediate crisis response.
Because we're kind of alluding to parents and adults in the room, but I see a lot of teens, and I see a lot of young persons in the room too. So we're talking to you too. If you have a peer, if you have a friend, if you have someone that you're sort of kind of acquaintances with, or maybe a friend, or not sure your relationship status, but all of the things that we've talked about tonight and these resources and the things that we're going to continue to panel about for the next few minutes, please share with the people that you encounter too. I can't tell you how many times we've used some of this information with people my own age, You assume that they got it together because they look a certain way or act a certain way. Don't assume. So we just want to make sure that you understand we're talking to all ages in this room tonight, and want to encourage you to use any of this for anybody.
There was a question about how to encourage someone who doesn't necessarily want to seek help, to get medication, to seek help. If they tell you, I don't want to talk to a counselor, I don't need to talk to anybody, I'm afraid to talk to someone, what do you do? What do you say? And so what I would say to my young person in my life is, again, I've noticed that you're not okay. You don't look like you're okay. You're not acting yourself. I know that you don't want to continue feeling this way. You don't want to feel this way. Usually if you use very direct language and you talk to them about that and you come from a place of caring rather than a place of force or accusation, I can't tell you the number of times that I've had that same conversation with a young person and the tears just start at that point because they don't feel well, they don't feel okay, and they don't like how they're feeling. And again, offering your support, I'll go with you. We're in this together. You shared this with me. Let me come with you. We'll do it together. We'll go and talk to someone. If you don't like it, we'll leave. We'll go somewhere else. And just really offering to be right there in it with them. I can't tell you how far that goes, especially for a young person that really is scared about what they're feeling and what they're going through.
One of the big things with that one too is when we do talk to our young people about these things, recognizing that what may seem trivial or insignificant to us, what as adults we realize is transient and passing, that can mean the world to them. That can be life-shattering to them. And if we take that idea and look at it through adult eyes, we're missing the point on it. Recognize what their perception is and take that as fact. If they say, this is how things are for me, believe them.
Be quiet and listen. Just be quiet and listen. Don't put your opinions in. You're not directing them. Sometimes people just need to be heard because for so long they feel like no one has listened, and that's your opportunity. Just be quiet and listen.
Really? Okay, so one of the questions that was written down on the card, if you would, please detail how if a situation or a call is done on a child at school who may be suicidal, is it or is it not part of their record? And so I think sometimes that deters people from asking for help because they don't want it to follow them. They don't want there to be this big file that screams all their dysfunction or their need or their questions. So we wanted just again to reinforce to you that mental health care and mental health intervention is protected, it is confidential, and it is very much encouraged. And it has that protection with it because we want there to not be that hurdle or that obstacle from you saying, it's time, I can't do it by myself anymore. So for those of you that are hesitant or not real sure, should I, because what if it follows me, or what if my chart falls open and someone reads it, it is a confidential process. And so it's very protected, and that's on purpose. It's intentional because we know that it is so hard to ask for help, and it oftentimes is so hard to kind of reach out and take that first step.
Is it okay to tell them that you've experienced some of the same thoughts yourself when you were their age? That's a big one. I think the answer to that lies in letting them know what you did beyond that. If you talk to a teen or if you talk to a young person and you say, this is where I was and I get this, I've been there, I've been in that hopeless, dark place, letting them know how you move forward beyond that and making that part of the focus of the conversation is important. Letting them know that this is something that may not be common, as far as being suicidal, but it's something that people do experience and something people can move past. Making sure they know they're not alone, and sometimes even making sure that they know my experience with this may be different than yours, but I know what hopeless feels like, or I know what hurt feels like, and going through that avenue with them. But yes, it's okay to let them know that you've been there.
And most importantly, that you got through it. That's what you want to focus on. Yes, I was there, I was in that place, but look at me now. And this is either how I did it, maybe you can share an experience, because this too shall pass. And we often, the vast majority of adults, know that, but oftentimes our teens and our young people, their brains aren't even developed enough to be able to see that far into the future. What is happening today is all that's happening in the world. They are the center of their universe. So it doesn't matter what's going on around them. This is very real to them. So yes, for sure. Making sure that you know what happened when you overcame that mountain.
That goes with a bunch of other questions. We've got several from people that are asking, how do I talk to someone that has lost someone to suicide? How do I let them know that I'm there for them? What do I say? How do I start a conversation with them? You know, one of the fun things watching the series, near the end, the protagonist says, you know, I really didn't want to say anything cliche. I didn't want to say, how are you doing, or are you okay? But he says, I don't know what to say. And so I'm letting you know that I'm here. Sometimes that's all it takes, is just letting somebody know we're there. And we don't have to know what to say. You know, we don't know the right words sometimes, and that's okay. Letting them know we're there, letting them know we understand they're hurting, and letting them know that we're there to listen. Like Megan said, sometimes that's all it takes.
Yeah, I was just thinking, be quiet and listen. We can't say that enough. And you don't need to say a word, you just need to be there, and they feel supported. It changes things. There was another question. Are you utilizing certified peer specialists? Do you direct people to resources like NAMI or Georgia Mental Health Consumer Network? Absolutely. We do have certified peer specialists at Willowbrooke. They work with every level of care, from inpatient all the way down to our outpatient clinic and everything in between.
Can you explain what that is? Explain what that is.
A peer support specialist. I apologize. A peer support specialist is someone who has experience in their history with either mental health issues or substance use disorders. They go through a full training, receive a certification. So again, it's hooking someone up who needs the support with someone who's been there, done that, and overcame. And it's so impactful. It is. It's very powerful. We found it to be very beneficial, even connecting someone on our inpatient unit with a peer support specialist, and they can assist them as they transition through different levels of care. So they assist them upon discharge in pressing the importance of them following up with their discharge plan. They call them and say, hey, don't forget, your appointment is on Monday at 9 o'clock. They may be calling them at 9 o'clock on Monday morning, saying, don't forget your appointment, and I'll even be in Willowbrooke, a partial program, to see you when you get there, because they met on the inpatient unit. So they have a familiar face, they've made a connection already, and again, it makes it easier. They've reached out for help, and they have the support and someone holding their hand as they walk through their recovery. With NAMI, we absolutely utilize NAMI. I'm actually even looking at, we're considering different things with maybe NAMI coming to provide some things on campus for us. We are very interested in reaching out to all of our resources in the community. We see a lot of people come through our doors, and everyone needs something different. So we want to make sure that what they're leaving with is specifically for them and meeting their needs.
One thing that we talked about earlier was this idea of mental health first aid. And if you look at it, this kind of idea of starting to talk to people when they're doing well is a key in that. When I'm okay, before I start to fall, setting up communication patterns with your young people, making sure that they know, if you've got a cell phone, we're going to be looking at your cell phone. making sure that if they're on social media, that maybe you have an account and you follow them on social media so that you can see what they're saying and what they're posting and what their friends are posting and saying. But setting some of those things up when they're doing all right means it feels less invasive to them when they start not doing all right, and it gives us a little more ability to start to see things as they're unfolding and be able to do something before it gets to a point that, you know, our young people feel like it's irreparable or they can't move past it.
Many of you may be sitting there saying, I don't want a Snapchat account, or I don't want Kick, or Facebook, or Instagram, or anything like that. I don't want to do that. That's so stupid, and I don't even know how. Y'all, that's part of parenting in 2017. Bottom line. There are things, we didn't know how to do things with our 3-year-old. We didn't know how to do things with our 10-year-old. This is the day we live in. It's part of parenting. Educate yourself on how to be a part of their social media. Like Brian said, not just monitoring it, because they can delete things and you don't really get to see as much of what their friends is doing, which is often is interesting and lends to what your child may be getting involved with. Now, you need to be their friend on their Facebook account. You need to have their Instagram account where you're seeing what their friends are putting and what they're doing all the time.
Guys, I think a lot of what we talked about tonight, it has a tendency to maybe feel a little overwhelming or a little daunting. We've shared a lot of information with you tonight, but one of the big takeaways, know that you have resources, and it is not a silence, it is not a independent, by yourself issue. It is something that must be done with others. The support is there, it exists. And we really just want you to take advantage of it. Most of us, you know, we can handle an illness with some over-the-counter medicine. We can take some Tylenol. We can, you know, try to doctor it. But once it gets to a certain point, we're going to go to someone who specializes in that, and we're going to go to the expert that can really address the need. And we want you to think of mental health in that same capacity. A lot of us can listen. A lot of us can ask some basic questions. A lot of us can show support and love. But when it gets to the point where it feels overwhelming, please access your sources in your community. We exist for you. The entire Willowbrooke system is alive and active and exists for your community. And so, you know, we don't like to say this very often, but man, use us. Totally take advantage of us, and, you know, totally, you know, take advantage of everything that you can from us, because we're passionate about it, but we know that it makes a difference, and we know that it works. So we just implore, please do so. And don't walk out of here tonight knowing, you know, feeling like that you don't have a resource or something that you can reach out to. For sure.
Do any of you have direct questions? Awesome.
Yes, ma'am. Is there a peer-to-peer model whereby you have something in place to train maybe some responsible 13 to 18-year-olds to be able to identify, recommend, I don't know, train, educate, maybe even be involved with actively identifying the warning signs and then pointing them to a responsible adult? But is there something in place where some children are being involved as well?
Yeah, I mean, we've alluded to youth mental health first aid several times tonight. In an ideal world, it is directed toward adults working with teens, but it's teaching the same concepts, whether you're a teen or an adult or anyone else. Yeah, the whole point is quit treating it like it's this taboo topic. Discuss it like it's a part of your conversation, and then it won't feel so awkward to say, yeah, it's time for it to reach out.
Are you guys training?
And we do, and so we have counselors in the school systems. They are leading groups. They are providing education. We're in talks with certain school districts to actually include some of this conversation into their health curriculum. So it's just a part of conversation rather than this sort of separate side topic. So great question, but yes, there's movement, but certainly not quick enough yet.
There was a question. When a person is talking about suicide after being bullied, what do you tell him? You tell him that you're going to get him some help. Because again, at that point, and that's not necessarily you, but he's 12, and I'm assuming that you're an adult in this person's life, and you're going to take them to get some professional help, whether that be with a counselor or a pastor or someone that can get them what they need. Because they've hit the spot, guys. If they're talking about suicide, they're saying, hey, I need some help. I need some help. And that they've just opened the door for you. Take the opportunity to get them professional help. And like I said, that comes in many forms. Don't feel like you have to have all the answers.
We have a few more questions up here. One of them, how do you tell the difference between being overdramatic and suicidal? I think we even saw that on the trailer where someone was identified as a drama queen and this is what was going on. The easy answer to that one is, what's the worst case scenario? And what if you think that this is something they're making up and we're wrong? We're wrong. I'd much rather go and get someone help and then say, wait a second, hold on. I didn't mean it like that, than have it turn out the other way. The whole part about perception from a teenager, again, if somebody says, you know, this is the end of everything for me, if it feels like they're being dramatic, it feels like they're being this, that may still be the way that they see the world. That may still be them having trouble controlling those emotions as a teenager. Get them someone to talk to. You know, find some help.
Or they may be looking for some attention for another reason. If a young person is asking for some attention, there may be some reason behind it. But again, we would rather deal with that once we've gotten to a professional who can assess that and who can talk to that person about, okay, what is it that you need help with? What are you looking for? How can I offer that to you? Once you've gotten them to a safe place, to a professional who can help assess that risk for you.
And teens will say, and we've talked about, I know the four of us have had conversations numerous times when we, as we adults often do, you know, think back to when we were in high school, and we didn't have that when we were teenagers. Oftentimes kids do say, well, I'll just kill myself. Or kids even encourage or tell other children, just go kill yourself. That is not something that we experienced as youth. It is so common, and they are so desensitized to go kill yourself or I'm going to kill yourself, that they often don't even bat an eye. But like Brian said, we rather overreact than underreact. We can get them there, get them the help they need, and figure out, well, this is a little much. They don't need inpatient. Maybe they just need an outpatient counselor. That's fine. Again, we reacted in the moment. We acted and got them where we need to. What steps would a teen take if another student in class shows signs of cutting and or discusses being suicidal? Do they just go to the school counselor, or should they discuss it with the student? I think they could probably do both. One being they must go to the school counselor. It's an option to have the discussion with their peer if they're comfortable with doing that. They must tell the school counselor or the teacher and adults in the school. And now I'm speaking to our youth in the room. Guys, you are our eyes and ears. We do not know what's going on with the peer sitting beside you. We need you for that. You are not being a snitch. Keyword snitch, because I hear our youth say that all the time. You're not being a snitch if you are saving someone's life. You're a lifesaver, not a snitch. Tell someone what your peers are experiencing.
Is 13 Reasons Why a good movie for young teens or teenagers to talk? Or does it glamorize suicide? I can tell you this, that this series was difficult for me to watch as an adult. And we got all of our staff together that did watch it and said, you know, what was that like for you? It was gut-wrenching. It is very graphic in a multitude of ways. you need to be prepared for that. If you are thinking about letting your teen watch it, I absolutely encourage you to watch it alone first. Make an informed decision that way. If you do watch it with your teen, make sure that you talk about it afterwards. And they've got a great follow-up show that comes on with it. It's called Beyond the Reasons, and it actually plays on Netflix within 5 seconds of the show ending. That talks a lot about why they chose to depict it in such a way, and that it's not glamorous, and that it's not a way to get revenge or get back or make a point, and that you have to reach out to other people. So, you know, if you're going to do it in an informed way.
Absolutely. I won't even say our youth, everyone, that's what entertainment does. When producers and directors are developing films, the hope is that the audience identifies with someone in the movie. That makes us want to watch it. You will have, your youth will absolutely identify with something going on in one of these teens' lives in this movie. But you know your teen. Are they mentally prepared to watch this? Can they handle this? Have they already been struggling? If they have, probably not the best movie for them to watch. But again, you know your child. Make an informed decision. You don't want to be sitting there with them watching it and not be prepared for what's going to happen on the screen, because it is absolutely gut-wrenching.
One of the things we wanted to make sure was that nobody walked out of this room without getting the information that they wanted to have. If we have any more questions in the audience, absolutely we'll take them. If not, I encourage you guys, we're going to be here afterwards, so you know, I know sometimes people don't want to bring things up in a public forum. Come up and see us. Come up and ask us anything that you want to. We're planning on sticking around for a while.
I do want us to close out. If I could get everyone from, say, 24 years old and under to stand up, please. Okay, so I want you guys to be loud. All your parents would say you could be really loud. So don't disappoint them now. Now's not the time. I'm going to make a statement, and then I want you guys to make the same statement after I do. We refer to these a lot as positive affirmations. Speak it and believe it. And so that's what we're going to do today, okay? I matter.
I matter.
I need it louder than that, y'all. I am wanted. I am unique. I am lovable. I am limitless. You're fading off. I can't hear you. And there's some teachers in here too that are saying, what? They've never been that quiet in their life. Y'all, I want you to believe this and know it. You are amazing individuals. You were fearfully and wonderfully made, and I don't want you to ever, ever forget it.
Thank you everyone for coming to tonight's Advancing Your Health education session. I want to remind you, in the bag, the same bag that you found the cards, there's an evaluation form in there. We'd like for you to just take a few moments to fill it out. It won't take long. Let us know what you liked about tonight, what we may be able to improve, and any courses that you'd like for us to perhaps add to the Advancing Health education series. Whatever it may be, we'd like for you to add that as well. There's also a form in there if you'd like to receive information about any other community events that we hold here at Tanner. There's a form in there for you to jot down your address, your email address, and your actual physical address as well. And in that bag, we want you to take that bag home, but leave the first two forms here. There's a resource guide, a quick resource guide for Willowbrooke Behavioral Health, with the phone numbers, many of the phone numbers that the panel mentioned, and also websites. And there's also a page with resources, the ones included on the screen now, and additional resources that you can tap into if you want more information. And we also have information and education booths in the back. So thank you again for coming on tonight. We appreciate you. And for the young people, you are lovable, and we want you to know that awareness is power and health is power. Always remember that. Thank you so much for coming tonight.